Ambassador Ishitani, Brazil is a big supporter of the work that UNAIDS does, and it's great to have you on this panel today. We talk about the right to health for all. Your thoughts listening to their lived experiences, the view from the physician and the caregiver, and how you play in.
Hi, Larry. Good afternoon. It's a great satisfaction to be here today joining this wonderful event on the occasion of World AIDS Day. The last mile is the most difficult one, so this is why it's important to be here today discussing a subject of highest importance also for Brazil. Well, many of you might know, but Brazil has been at the forefront in the fight against HIV/AIDS. We were the first country in the world to offer free treatment for HIV/AIDS patients. In fact, we have the largest universal health system in the world, and the right to health is constitutionally guaranteed. Sound public policies have been implemented since the 90s, aiming at increasing our production capacity, including technological cooperation and price reduction, so as to make available for free the most innovative tools for HIV prevention, diagnostics, and treatment. To share a number with you, currently around 900,000 people are under treatment in Brazil, and annually a budget of around $500 million is allocated for HIV/AIDS fight. Our legislation also protects the privacy of patients with HIV. And since 2014, any kind of discrimination is legally criminalized. So as the last mile is the most difficult one, what has been Brazil doing recently? Well, in April last year, Brazil launched the program Brasil Saudável is Healthy Brazil. That was an interministerial committee that was created involving 14 ministries, Ministry of Education, of Women, for racial inclusion, for indigenous peoples, and it aimed at the elimination of social determined diseases. And of course, HIV/AIDS was one of diseases included. The day after tomorrow, a specific plan for the elimination of AIDS until 2030 will be announced, with a specific focus on vulnerable people. All ministries involved will offer a special solution for a specific group. The idea is to further reduce stigma and enhance the whole of government and whole of society approach. To share recent advances, last year, mortality rate among infected people was reduced by 6.5% in Brazil. Internationally, our contribution to the last mile has been done through engagement with other health organizations, such as UNITAID, which promotes innovation and equitable access, complementing UNAIDS advocacy. In the Human Rights Council, in the last session, Brazil was the pen holder. We led a resolution entitled Human Rights and in the Context of HIV/AIDS, which recognized the centrality of human rights in the HIV response. Having Portugal, Colombia, and Thailand as co-sponsors, it was possible through much dialogue with civil society, governments, also with the help of UNAIDS, to finally approve a resolution that was approved by consensus. This is really an important achievement and also an important sign of international support to advance the fight against HIV/AIDS from a human rights perspective. Also, during the G20 presidency, G20 health ministers in Brazil reaffirmed their commitment to end the epidemics of AIDS in a framework of sustainable and resilient health systems that is clearly stated in paragraph 8 of the Ministerial Declaration of the G20. Brazil is also part of the Global Council on Inequality, AIDS and Pandemics, an initiative launched by UNAIDS. The Council gathered on the margins of the G20 Leaders Summit this November and calls global attention to the fact that inequality is a main driver of pandemics. Our Minister of Health in Brazil, Minister Nízia Trindade, is not only a supporter, but she's also a founder member of this council. To conclude, if on the one hand, the HIV experience has proved how global solidarity can change the trajectory of an epidemic, on the other hand, the resurgence of discriminatory policies and the lack of funding remind us that political and financial support remain as needed as never. This is why reinforcing human rights and the provision of resilient health system is so important. So I congratulate again UNAIDS for this initiative. UNAIDS has been a crucial partner in this fight, and thank you for gathering us today. I also thank so much the opportunity to be here and reaffirm Brazil's full engagement in the fight against HIV/AIDS, which has proved to be a protracted and fully fightable pandemic. Thank you.